Hi, I'm Renee. I'm Dr. Gazelli's physician assistant and second pair of hands during surgery. You are getting ready to have an anterior lumbar interbody fusion. Today I'm going to walk through the procedure and recovery period with you from start to finish. Please feel free to take notes. I'm happy to go over any questions that you have or go in more detail with you on anything face to face. This is not meant to be comprehensive, so I do anticipate that you'll have questions, but hopefully this gives you a good amount of information on the procedure and the recovery period. So on the day of surgery, you'll first be brought back into the pre-op holding area, and the nurses there will start an IV and get things prepped and ready. They'll make sure all medications and current medical history is updated in the computer. You will see the anesthesiologist in the pre-op holding area. Sometimes they will call you the day before surgery. So on that day before surgery, if you get a phone call from a number that you don't recognize, you may want to pick it up because it could be that anesthesiologist just wanting to chat with you and get to know you a bit. You will also, of course, see Dr. Gazelli and the vascular surgeon prior to surgery in that pre-op holding area. They are happy to go over final questions that you have at that point. As far as the approximate time and what your family should be expecting, typically a one-level fusion should take us about 2 hours, and a two-level fusion would take us about 3 hours. We're always happy to keep all your family or friends, whoever's there with you, informed and up to date during the procedure. The nurses in the operating room can give them calls and keep them updated. Of course, Dr. Gazelli will call them and come see them after the surgery as well to discuss things with them. If they are there at the hospital, he's happy to sit down with them face to face. If they can't be at the hospital, that's okay. He's happy to call them on the phone and chat with them after the procedure as well. As far as what happens in the operating room, you've probably already watched the procedure video, so you know a bit about the procedure, but this will just give you a brief recap and answer some commonly asked questions that people have. This surgery is done under general anesthesia, and we will have people in there monitoring your nerves during surgery. So after you're asleep, they're going to put little baby needles all over from head to foot. So while the surgery is going on and we're operating, they will monitor the nerves, and if anything starts acting abnormally, they will let Dr. Gazelli know right away. I also mention them because if you wake up with pinpricks, bruises, or bleeding, that's what that was from. The incision and exposure down to the spine is done by the vascular surgeon and his assistant, and that incision will be in the lower part of your abdomen. And once the vascular surgeon has the exposure down to the spine, Dr. Gazelli and myself will come in, and Dr. Gazelli will go ahead and remove any little bit of bone spurs and the disc material, and then put the bone graft and fusion in place. We usually use a cage and some bone graft in there, as well as he would use some screws or possibly a plate and screws. So once that graft and instrumentation is in place, then the vascular surgeon and his assistant will come back in and complete the closure of the wound. Typically, the incision is closed with layers of dissolvable stitches, and the top layer is dissolvable as well. There may be steri strips or white skin tapes on there as well right over the incision. And once that is completely closed, a gauze bandage will be placed. You will then be brought to the recovery room, and the nurses there in the recovery room will watch you and monitor you closely as you're waking up and make sure that you are waking up okay, help with any discomfort or pain and controlling that for you. They can give you some ice chips and maybe a little bit of liquids after the surgery in that recovery room. However, because it's an abdominal surgery, your belly will fall asleep a bit, and we'll let you have real food for a little while until that belly is waking up a little bit. So initially it's ice chips and maybe liquids. Once you are recovered and awoken from the surgery in the recovery room, you'll be brought over to the hospital floor. There is a spine and orthopedic surgical floor that you will stay on. There are nurses and physician assistants on that floor that work there regularly and are comfortable taking care of spine patients. All rooms are private, so you will not be sharing a room with any other patients. We will have a few different types of pain medications and muscle relaxants available to you to use as needed for any discomfort or muscle spasms that you might be having while you're in the hospital. There will be physical therapists and occupational therapists also working with you while you're there on walking, getting in and out of a bed or a chair, and basic daily living activities. We will also be advancing your diet slowly as your belly is waking up, as I had said before. You will also typically be in a gown most of the time that you're in the hospital. However, you're welcome to bring any comfortable loose fit clothing to wear or especially to go home in. You're also welcome to bring any toiletries or things of that nature that you wish from home. While you're in the hospital, you will be seeing Dr. Gazzelli or myself on a daily basis. If you're staying over the weekend, you'll actually also see myself, Dr. Gazzelli, or one of our other surgeons or physician assistants who may be on call that weekend, seeing and taking care of our inpatients. You will be discharged to go home once you're cleared from the physical therapist and occupational therapist. Your pain is relatively controlled, your belly has woken up, and that's when we can get you discharged to home. You will be given pain medications and muscle relaxants to go home with. Typically, we'll work on those couple days that you're in the hospital with the medications, and once we know what's best for your pain and comfort, we will discharge you with those medications to go home with. The pain medicines and muscle relaxants are to be used as needed. This is also a reminder that we ask that you not take any anti-inflammatories for 3 months after surgery. That can inhibit or slow the bone healing, so we ask that you not take any of those. Those include Advil, Aleve, ibuprofen, Motrin, naproxen, those types of medications, both over the counter or prescribed. Again, avoid for 3 months. Over the counter, Tylenol would be fine. As far as what to expect initially after surgery and the physical restrictions that we ask you to follow, walking is going to be your main therapy and exercise that first 3 months after surgery. So I do want you walking. We'll get you up and moving relatively quickly in the hospital, and when you're at home, I want you getting up and moving and alternating positions on a regular basis. So if you're sitting around during the day watching TV or reading, please get up every 45 minutes to an hour to walk around the house, get a drink of water, go to the bathroom. If it's nice outside, feel free to take little short walks outside. And initially it will be small, short little walks throughout the day, but multiple short little walks throughout the day. Not just one long walk that just wipes you out for the rest of the day. As you're feeling more comfortable and recovering, you're welcome to move those walks into longer, fewer walks throughout the day. But again, this is your main form of exercise, and we don't really have you do much else as far as real exercise that first 3 months. The other restrictions we have you on are no bending, no twisting, and no lifting more than about 10 pounds, again for the first 3 months. We'll also have you in a brace. And the rule of thumb with the brace is that you'll wear it anytime you're out of bed longer than about 5 to 10 minutes. So meaning that you don't have to sleep in it. If you're getting up in the middle of the night to go to the bathroom and straight back to bed, you don't have to have it on. But once you're up for the day, whether you're sitting, standing, walking around, you'll have it on. It's just a nice kind of corset to help support you a bit and also remind you not to do some of those activities such as bending, twisting, and lifting. You will also have white TED hose or stockings on in the hospital, and you'll go home with those. You really don't need to continue to wear those once you're home, as long as you're getting up and walking a good amount. But if you're not walking a lot, or if you're having swelling around the ankles or lower legs, then you should keep those TED hose on. As far as showering and wound care goes, you can get the incision wet and start showering the second day after surgery, or about 48 hours after surgery. For some of you, that may be at the hospital, and others it might be at home. So once you're ready for that shower, you'll take the outer gauze bandage off and get in the shower and shower like normal. As I said, any steri strips and the incision can get wet in the shower, but I do ask that you not let the water pound on the incision, and don't scrub over it, don't soak it in a pool or a bathtub, showers only. And then once you're done with the shower, you'll just pat it dry and put a new dry gauze bandage on it. There's no need for any ointments, creams, lotions, nothing like that on the incision. Just keep it clean and dry. As far as driving goes, we ask that you not drive as the driver up to that first week out of surgery or first post-op. And this is mainly because of the anesthesia that you've had, the stronger meds during the procedure, and the need for narcotics if you're taking them. So if you are taking pain medicines throughout the day, you shouldn't be behind the wheel. And typically by that first post-op, we'll talk more about that. And if you're not taking the pain medicines much during the day, we will clear you to drive. But we'll talk about that at that point as well. And as far as work goes, if you have an office type job, sedentary type job, We typically can get you back to work within maybe a week or two. You're welcome to work from home whenever you're feeling clear enough in your head and comfortable to do so. And when you are ready to go back to work, whether it's a week later, 2 weeks later, or whenever the case may be, we usually recommend, if you have the capability of going back only part days at first, that's usually beneficial, because smaller activities or activities that are normally not a big deal for you can really wipe you out after having general anesthesia and the pain medicines and everything. So usually going back to work a full 8 to 10 hour day, that first week back to work, is oftentimes too much. So if you have that capability of going back part days and then maybe doing some work from home as well, that's fine. And maybe for the first week or so, and then advance it to your regular hours as you're comfortable. For those of you who have more physically demanding jobs, like construction workers or anyone that just has to be more physical at work, unfortunately you're going to be out of work a little bit longer as far as full duty goes. Light duty we can get you back to if your job has that capability or has that to offer. But as far as physical work goes, we really restrict your physical activities for 3 months, and then we start physical therapy. And we really want you stronger before we allow you and clear you to do full physical duty. So it could be 4 to 5 months or so before we're clearing you for physical duty or physical work. As far as complications that we will discuss about this, of course, I would anticipate you have some incisional pain or numbness around the incision. That's normal in the abdomen. You may have some abdominal or back pain, and this could be just post-surgical type of back pain. Some people may notice a difference in the back pain that they feel, that it feels more post-surgical and not the pre-surgical back pain they had been living with. But some people, it's just too early to tell, and they just say, yep, I still have back pain. And that's normal as you are in that initial healing phase. We also, if you are having any types of nerve symptoms, you could be having some persistent symptoms still after surgery. Once we open up the spaces and distract the space around the nerves, a lot of times they're decompressed and the symptoms are better than they were prior to surgery. But nerves heal slowly, and so once we've stabilized that area, it can take a little while for the nerves to fully heal. And so it's okay if you still have some symptoms, but hopefully they're much less constant or less severe. And having said that, with that distraction and work that we do around the spine and the nerves, sometimes we end up stretching the nerve a little bit. And so occasionally a patient could wake up with some increased leg symptoms, whether it be pain, numbness, tingling, or weakness. And that's just from that a little bit of acute inflammation from us being in there and irritating the nerve. If you wake up like that, we will use some medications to calm down that inflammation and stabilize that nerve. That is typically short-lived and does get better with time, and we'll support that with you with medications to calm it down. Another complication we talk about, which is rare, but it can happen, so we talk about it with these anterior approaches for men, is retrograde ejaculation. Oftentimes this is self-limiting, but if it happens, it could cause issues with fertility, and we would refer you to work with a urologist if this was occurring, where the ejaculate was going back towards the bladder, and you did get that retrograde ejaculation. Again, this is a pretty rare complication, but it has happened, so we talk about it. Anytime we're trying to get a fusion to grow and bone to knit together, there's always the chance that that fusion fails, that that bone doesn't fully grow together and solidify. If that were happening and you were having symptoms because of that non-union, it may necessitate another surgery to revise that fusion. But usually with this anterior approach and the graft and the cages that we put in there, it's not something we commonly see. But we will monitor this fusion closely with x-rays at every visit, as well as your symptoms. As far as when to call us after surgery, any changes in strength in the form of increasing weakness, decreasing strength, concerns of that nature we want to know about. Any increasing symptoms, meaning pain, numbness, tingling, weakness, as I said, anything that's escalating and not calming down, please let us know. As I said before, it's normal to still have some symptoms, whether it be back pain, some abdominal pain, some leg symptoms, and hopefully things are overall improving with time. You may have some days that are better than others, and you just might feel it more one day or another for no rhyme or reason. And that's normal as long as overall it's improving. But if you're all of a sudden having escalating symptoms that are not calming down, please call us and chat with us about it and we can discuss it further. Any persistent fevers or signs of infections around the incision, of course, please let us know. So if you see any increasing redness, swelling, new drainage from the incision, along with those persistent fevers, please don't hesitate to call us and let us know about that as well. And any persistent nausea or vomiting, please call us as well. We can help with some medications if necessary, and we'll talk about that. As far as when you will see us next, we typically will see you at your first post-op about 7 to 10 days after surgery. And at that visit, we'll look at the wound. If there are any steri strips or sutures to trim up, we will do so. Oftentimes it's just to examine it and there's no sutures to remove with this closure. We'll get x-rays at that visit and review those with you. We will overall check in and to see how you're feeling, how you're doing, answer any questions that you have at that time, refill medications if necessary. As I had mentioned before, typically after this appointment, we can clear you to drive as long as you're not taking the pain medicines or narcotics during the daytime. We then will see you at your 3-month post-op visit, which is when we'll start weaning you out of the brace and starting the physical therapy. We then like to keep track of you and see you at your 6-month post-operative visit and your 1-year visit. We will get x-rays at every visit to monitor the fusion, and we do like to check in with you periodically, especially throughout that first year after surgery. And getting you back to normal, at 3 months after surgery, we will, like I said, start weaning you out of the brace and start you in physical therapy for core strengthening and stabilization. We will give you that order at that appointment and get you scheduled if we need, or help you get scheduled if necessary. In conjunction with starting that physical therapy, we'll let you gradually increase your normal activities as far as bending, twisting, and lifting and normal activities. Of course, keeping in mind proper body mechanics when you're doing those types of things. And as you're working with the physical therapist, they can help guide you in getting back into your normal exercise routines, sports, or physical activities that you enjoy doing. I always like to mention to patients that this is a fusion. It can take a while to heal and to fully recover, and it could take up to 6 months until you've kind of gone through that physical therapy, until you're feeling more like yourself and like you're doing your normal activities. For some people it doesn't take that long, but for some it can take around that time or even a little longer. And it really does take about 6 months for the fusion to become fused, even though we do sometimes see growth of good bone growth between the 6-month and 12-month. But usually by 6 months, the fusion should be relatively solid. So I like to keep that in mind for you as well. So hopefully this video has given you a good amount of information about the surgery you're about to have, the day of surgery, and your recovery period. But please don't hesitate to call or email us at any time if you have questions or concerns. Thank you.